Hey everybody, this is Dr. Jay Greenstein here. I am coming to you live, although you're going to see a tape. I am actually live right now. And I'm with Dr. Brian Coleman. Brian, it is great to see you, sir.
Great to be with you here today, Jay, as well.
So it's kind of an interesting story because I learned about you through an article that was posted that you published. You were first author on, that you published in, was it Chiropractic Manual Therapies? Is that correct?
Yes,
And
that's correct.
yeah. And it was posted on the HealthTech Tribe Facebook group. Stephen Pearl, who is a mutual friend, posted that paper, and I was super excited to read it. I thought I was going to do cartwheels down Pennsylvania Avenue. I live here in DC, and so I was pretty excited because Brian, I think it's pretty safe to say that you published the first paper really that was the intersection of technology and chiropractic. So before we get into that detail, though, just do me a favor. Tell everybody a little bit about yourself and your background.
Sure, absolutely. I'm trained as both a chiropractor and a biomedical engineer. My interest in both engineering and chiropractic care specifically, or I guess more broadly in non-farm pain management, led me towards completing a fellowship in medical informatics at the VA Connecticut in West Haven, Connecticut. And so I've since remained there, having completed my fellowship earlier this year. I able to provide chiropractic care to our veterans there at the VA Connecticut, as well as work with our national program office to help promote chiropractic care within the VA. It's great working there in the VA. It's the largest integrative healthcare system, and so it's a really fun opportunity and a really unique environment to get to practice as well as get to conduct research. And so in addition to my role there as a chiropractor, I also serve as the Director of Information Technology and Scientific Communications for the NIH DoD VA Pain Management Collaboratory, specifically its coordinating center, which is hubbed at Yale. This effort is a centralized resource hub that helps with organizing and supporting 11 different pragmatic clinical trials that are studying either pain care models or non-pharmacological approaches to pain management within the Veterans Health Administration and the Defense Health Agency. And so I have a few different roles, a few different hats that I wear. In addition to that, I also teach at Sacred Heart University in their Masters of Informatics program, specifically teaching courses in emerging technologies, as well as the electronic health record and population health. So kind of have a nice little intersection of all of my interests, pulling together some of my engineering background, as well as pulling together some of my experience with informatics, and being able to provide a little bit of clinical insight in some of those classes that there's some value in doing that. So I really enjoy so far what I'm able to kind of pull together and wearing all my different hats.
So you have a lot of free time on your hands.
Always, you know.
So Brian, do us a favor. Give us the highlight, like the couple of highlights from the paper that was just published in Chiropractic and Manual Therapies.
Sure. So this was I think as you mentioned, it's like the first intersection of really digital health and technology with chiropractic data. And so nobody's done any sort of predictive modeling using machine learning before. Most of the predictive models developed relevant to chiropractic care have all been about people who might respond well to spinal manipulation. So it's mostly like clinical prediction rules. We wanted to take it a step further. Wanted to look and see on the more of the larger scale, on that kind of more meta scale, could we predict chiropractic service utilization? Could we predict how many visits somebody needs based on some characteristics that they have? So whether that be demographic characteristics or clinical characteristics, the presence or absence of certain comorbidities, some of the characteristics about their episode of chiropractic care. Did they have care for only low back pain, neck pain, both? Was it for some condition that did not involve the spine? So we included all of these things in our model, and the advantage to using machine learning is that you can do that. You can have these really large data sets with lots of different features. Your matrix can be very sparse. It doesn't have to necessarily have be really dense and full. You can have a lot of missing values because you can actually learn sort of patterns with that as well. And so what we decided to do is really try to push the envelope a little bit, step into this different world and see if we could do some predictive modeling. And what we found was it was really challenging in order to actually predict how many visits somebody needs. We did bin them into different classes. So we had a group that was a 1 visit group, a group that was a 2 to 3 visit group, a group that was a 4 to 6 visit group, and a group that was 7 or more. And so one of the interesting things that came back during peer review was somebody mentioned, would you think to maybe predict just as a single level, like pick some clinically relevant threshold and identify who the people are who are high users, like people who would use a lot of visits. And what we found was, based on the way we had already developed our methods, we still couldn't predict that either. And so we did have a little shift in our sort of from a random classification probability. We found that it was about a 15% shift in our ability to accurately predict how many visits somebody uses. And so what we found is there really needs to just be more data. We need to look at more relevant data, look at what occurs during, say, an example, a trial of chiropractic care. Look at what is occurring at those facilities. Is there some scheduling conflicts? Is there some difficulty with, travel or parking, even things like that might drive patients away from access? And so it was a really interesting, eye-opening study that really opens the door for a lot of future work, I think.
I think that's unbelievable. It's great stuff. And I think about patient experience as well, because that can drive behaviors as well. So, what might be the experience they're having with one provider over another that also might be predictive inside that model. So there's obviously so much more work to do, but you guys took a huge first step. I'm like envisioning like landing on the moon. Maybe I'm exaggerating a little bit, but that's how happy I was when I saw this paper. But I mean, you're taking a huge step. You're at least starting the process. And as you guys continue to look at the data, use machine learning, develop stronger models, we're just going to be stronger. And most importantly, we're going to be able to help our veterans more, which I think is just tremendous. Tell me, what do you think? In your opinion, what do you think are the most important technologies that really need to be adopted by healthcare providers right now, and why? Like, what should doctors be thinking about adopting today?
Sure. So I think there's 2 that really stand out to me the most. First is actually a bit of a more broad collection of a few different technologies. I encompass them all in remote patient monitoring, because I think that that's really going to be a way in which healthcare moves in the future, and especially is evident right now during this COVID pandemic. The ability to monitor patients remotely is huge. And so huge. I always tell my patients, I see you for a half hour a week, maybe for a few weeks. And so it's really more about what are you doing in all those other half hours during the week. And so across, that's specific just to, a chiropractic clinic, but across all of healthcare, this really is true. So with digital health advancing, we can get a more complete picture than just, what does the CBC say, or what does that chem screen say, or what's the historical information that a patient may recall at the visit compared to what they even, recall during the rest of the time period that they may be, experiencing, let's say, pain. And then, what can we take beyond just like that cross-sectional snapshot that we get of a patient on an exam table? And so I think that just collectively and in general, those remote patient monitoring devices are really the next step that we really need to invest a lot of time and effort into identifying how they fit within the clinical workflow. Mm-hmm. And so that leads then to the
second one.
Yeah, that leads to my second thought is the electronic health record. And when I say that, I mean it in that widespread adoption on a system level is already really occurring. 99% of health systems, let's say, already adopted an EHR. But I think on the individual level, we can adopt it better. And I think that's the key, is that it's really still this example of disruptive innovation that's still developing. A lot of healthcare providers will complain how it's actually made care worse. It puts a barrier between you and your patient in a room and so on. And, it creates burnout, and it leads to, pajama time where you're documenting at home already outside your job hours. But the reality is the electronic health record does actually make your job easier. You just have to learn how to use it to your advantage. It's a tool. It's not, you know, you have to work it into your workflow. And so, for example, I'll use it at times to help build trust with a patient. I'll say, you know, hey, come look at this screen with me while I document your encounter. And they'll understand, you know, what am I putting in their record? You know, does this look correct? Do you think this is right? It's their record. So when we find that, you know, if you're closing it off like we used to do with, you know, a paper chart and like, no, this is mine, and you got to request a chart and it takes months to get, it's so much easier now, especially with personal health records, and a patient can go and reference that later on that night. And I think the most important thing is that it actually makes care for patients better. As much as it may make the job a little bit harder for the doctor or the nurse or anybody who's providing care, it does actually still make your job easier, but most importantly, it makes the patient care better. You know, if they go home and they forget what you told them, most of them now can just log into that personal health record, review what you said, assuming that you actually documented it in there. But that makes it a much better opportunity for patients to really be able to say, you know, I feel like I connected with my healthcare provider in that visit. It leads towards better things like self-management, which, like we know in the chiro world, low back pain especially, even there was recent paper published in Pain following up on that, the studies published in Lancet a few years ago. And one of the big call outs was still self-management for low back pain. And I think that kind of ties both of them together a little bit, the electronic health record and remote patient monitoring, because, you know, we know self-management is one of those key recommendations. And if we can monitor that remotely, we can say, okay, we can see when somebody's potentially falling, you know, sort of down the hill and they're regressing. We can see when patients are really at their peak and they're really doing well. And we can then just translate that right into the electronic health record, pull those data in a way that makes it usable for, you know, us as an individual provider, as well as all their other providers, for researchers, and for the patient themselves to really track over time and say, hey, I've done really well. Look at what I'm doing, and I didn't go to the doctor.
Yeah, I love the idea of actually showing the patient what you're documenting, because I agree that's a great trust building exercise. I mean, and I'm going to have my doctors watch this interview, so they'll see that. So docs, get ready to show your patients what you're documenting. But what I also think is really important about the electronic health record is its evolution. It's like, you know, maybe when the internet started, people were like, oh no, the internet scares me, I don't really understand it. But like, electronic health records is not only here to stay, but it's integral to the evolution of healthcare on this planet, and how we use them is critically important. Interoperability is still a huge issue. And for us, at least, we use a company called Genesis. It's a cloud-based system. We've literally helped them rebuild the system so that we could aggregate any data point in the system, so that over time we can use analytics, we can use machine learning to be able to actually determine which providers are getting the best care, what interventions they provided, and how we can deliver that across the entire scope of our practice and across the entire scope of all the Genesis customers. So, you know, it is so important. The information that we put into these records can be critically important to not just the individual patient standing in front of us, which is critically important, but also to improve population health over time. And I mean, that's when we're really moving the needle tremendously. You know, there's lots of barriers to implementation to health tech and healthcare practices. Brian, what do you think is the biggest?
So I think, I guess on a higher level at first, like a lot of these digital health technologies are really new. They're like this shiny new toy in the room, and it's really easy to get wrapped up in wanting to use something before there's really evidence on the efficacious use of it. And so I think a lot of times we really just need better data and more data, and some sort of really detailed evaluation of the utility, the efficacy, the usability, of these digital health technologies that are being integrated in care. I think that's step one, is getting that. That's one of the key barriers I see. And then going beyond that into sort of more individual technologies or things that are kind of shared across the board. I think obviously cost is one of the big factors. It requires usually an upfront investment, and a lot of times these things aren't very cheap. And there may not even be a return on investment, because in many instances, it's really a tool to help you get your job done, but it's not necessarily a billable service or something you're going to use for that. And so there's some lack of like extrinsic motivation that really comes with that. And so we really need to focus on that intrinsic motivation. It's better from an individual change management perspective to really motivate people with more intrinsic motivation. It lasts longer. It's better to really focus. That's how we're implementing digital health, that we want to focus on those intrinsic motivators, I think, more so than those extrinsic motivators. And then just to sort of add to being a chiropractor, I think one of the barriers that we run into in our profession especially is this relegation of our identity towards, being a chiropractor. We must be hands-on only and do manual interventions, and not incorporating some of the other tools in our toolbox that we might have, like things like remote patient monitoring, or encouraging more self-management, encouraging patients, using potentially things like outcome assessment measures that are tracked through, an iPad or an iPhone or some other smartphone technology that's really ubiquitous now, that we can really capture data on such a bigger scale continuously and really understand how our patients are living their day-to-day lives, and not just focusing on, spinal manipulation, as that's our go-to and that's what we're going to sort of hammer home.
Yeah, I mean, at a very basic level, when COVID hit, we had already had telehealth implemented. And so we just literally turned on the switch, turned on the computer, and we were ready to interact with our patients. And it really helped. It helped on a variety of levels. First of all, it helped them clinically because we could provide exercise instruction, palliative instruction, things that could get them through the day, through the week, through the month. But even more importantly than that, in my opinion, was the connection that we maintain with them. Just to let them know, like, we are here for you. We can use digital technology to support you during this time when you're not able to come into the office. So yeah, I agree. It's critically important. Okay, one of my most favorite questions: what is the most exciting emerging technology on the horizon that you are just like incredibly excited about?
Sure. So once again, sticking with my theme, I have two answers again. I have two because I think they really fall in different camps. One is really towards more data management, and the other is sort of more broad use. I think broadly used across more healthcare in general. And so the data management one that I really like right now is blockchain. And I think because it's a really simple concept that really carries a lot of weight and can really impact clinical care in a really unique way. Super interesting about it. There's like anthropological studies going back showing that going back thousands of years, there's been decentralized data management. It's not something new, but it's applying this technology in such a new way. I don't think necessarily it's going to make this huge splash in healthcare data management just yet. I think it's going to be common in startups and smaller companies at first who are going to propose using it as like the backbone to their other ideas in the short term. But until there's really more widespread adoption across healthcare at large, there's not going to be that much use. Kind of similar to, it's kind of like the opposite of the electronic health record. All the big guys bought it up right away. The smaller practices sort of held out and learned lessons. I think that healthcare as a whole is going to really wait until the financial industry takes advantage of it for a little bit longer, really learns a lot more of those lessons in blockchain, and then decides, okay, it's time to really move this over into the healthcare industry and let it grow and flourish from there. And so I think blockchain from that data management one is really interesting.
Yeah, there's so many use cases for blockchain, not just in data management, but there's like so many use cases in healthcare, which I'm also very excited about. So I'm sorry, didn't mean to interrupt. So number two, what's number two?
No worries. Yeah, number two, no surprise, is artificial intelligence and machine learning. I mean, obviously that's, how we came to connect with each other, and it's my own personal area of interest. There's just so much data now that are being collected. It's more than ever being digitalized in the EHR. And even beyond that, there's the digitalization of medical literature that we previously haven't even, there's millions of articles added potentially, let's say monthly or even every few months. And so we can't, one individual can't necessarily be expected to really review and read all of that. And so things like IBM Watson, when that first came out, and even since, they've refined it to focus their attention a little bit differently, focusing on medical literature and presenting information to the healthcare provider at the point of care, rather than trying to do the predictive model itself. I think it's going to help us to really uncover some of those deeper patterns and relationships in the data that are available, and really better identify the patterns in the medical literature that might be relevant to present for case management, and get it into the right place, the right information in the right place, the right time for the right patient. I think is really going to be key, in one way in which we can really take advantage of the use of artificial intelligence, machine learning, adding in things like natural language processing to process those papers that are out there in just massive quantities, and pull all those data together and really synthesize it so that a provider can use it at the point of care.
It's so interesting that you say that, because I've had many conversations with my tech team internally about what we deal with at the clinical compass. So I'm past chair, was chair for 3 years, and we work on a shoestring budget. We have great donors who help us support the chiropractic profession through creating clinical practice guidelines, but it takes a long time to create one of these guidelines. And like, I've had internal conversations like, we must start using these emerging technologies, or existing technologies, not even emerging anymore. They exist, and they're I wouldn't say widely used, but they're used a lot, as you know, to rapidly increase the rate which we get this information out there. And then I think, your comment about, getting this information into the EHR or in front of the provider at the point of contact is a place that I know we'll ultimately get to. I think we'll see it in our lifetime, but I think will make a tremendous difference in how patients are cared for and the outcomes that we create. The one question I have, though, is, how do we decipher the good literature from the bad? So, we know there was a something I posted on the HealthTech Tribe Facebook page around the quality and the ethical nature of some of the publications that are out there, that, there was artificial intelligence was being used essentially to determine whether or not there was a conflict of interest or not with the papers that were being published and the conclusions that were drawn. So, what are your thoughts around that, Brian? Like, how will the system, how will the engineers figure out what papers to include that have valid and reliable and pertinent findings, and the ones that we know are just funded by the company that wants to see the results they want to see?
Yeah, that's a great question. So in machine learning in general, there's a phrase called garbage in, garbage out. So your output's only as good as your input, right? And so if you put in garbage into your model, you're going to get garbage coming out of your model. Yeah. And so I think we have to it's going to come down to having good quality data that are inputs to those models. And that's going to require a lot of annotation by individuals. That's going to be the human component that goes into building the models, of sitting there and going, this is these are points of a high quality study versus these are points of a lower quality study. And that's where we can also lean on the higher impact journals and the higher quality journals to really be what we weight our inputs on a little bit more. And so when you look at a higher quality study that might be published in something like JAMA or New England Journal, those might carry a little bit more weight than something that's published in the journal of this pharmaceutical company who wants to push this specific intervention. And so I think that once we can really identify that tipping point and somehow quantify the objectivity and really take advantage of the high quality peer review that goes into many of those higher quality and higher tier journals, and put a little bit more emphasis on those. Not saying that we won't have, there's potential noise in any data. And so there may be some studies that are found to be less, or that findings that are published in potentially middle or lower tier journals might be just as valid or even more valid than those that are published in higher tier journals. But when it comes to building the model, we can start to lean on some of those processes that go into publications that we just hope they do the right job, and use that as sort of a means by which we can filter out some of those bad data.
Yeah, it's so funny. I was thinking, it's great that we could use artificial intelligence to literally filter out that garbage and know, okay, there's a conflict here, and these results, these conclusions, these recommendations might not be appropriate. Super insightful. Thank you. So I could sit here and do this all day, but we'll just do one more question.
Sure.
If that's cool with you.
That works for me.
So I would love to hear your recommendation about the one thing providers could do right now to implement key technology in their practice. Like, they were to take one action step this week, what would you recommend?
Sure. So I think the biggest thing is to start reading and read a lot. And the reason I say that is if you can keep up to date with advances in digital health, you'll be ahead of the game, and you'll be, able to identify when things are good and when things are bad. But it's sort of all or nothing. It's either you're going to be like, if you're only dabbling, you're going to be behind the times. So you kind of have to just go for it and be like, I'm going to jump in every Facebook group. I'm going to jump on every Twitter page. I'm going to follow everybody on Instagram, and use social media to your advantage to help find those things that are up and coming and really, going to push the envelope and move healthcare and move healthcare technology, going forward. I think, it's a bit cliche, but you got to just say, like, just do it, be the scientist, study the literature. If something seems like it's interesting and valid and has some value to it, try it with your patients, see how it works, get some feedback, iterate, improve on that. All of us are trained to read science, but that doesn't necessarily, every human being is a scientist. We can all, employ the scientific method in everything. We do so when we eat dinner. We do, you say this is going to taste good, and then it doesn't. You refine it. And so it's not like this is something new that somebody needs, super formal training to try. Not saying that formal training isn't valuable, but you can certainly, really just learn by, trial by fire, sort of get in there, learn from the people who adopted before you, continually refine your methods, and then be open to really abandoning that shiny toy, like I called it before. It's a method. Technology is a method. It's not the goal. And so really keeping the context very clear of what your goal is, which is improving the life and the care for your patients and the quality of life for your patients, and keeping that in mind and not letting, that shiny toy kind of cloud that is really important. But I think it starts with really just learning the environment and getting out there and working through those steps and really just being able to keep that focus on how can you use this to improve patient care and improve the quality of life for your patients.
Yeah, I love that. I mean, I said the word awareness many times to my team last week. Become more aware, learn more, be observant of the world around you and what the world is going to be becoming. So that's great advice. Thank you so much. So listen, Dr. Brian Coleman, this has been incredibly enjoyable. It is just awesome to listen to you and your experience and your impact that you're having on chiropractic, on healthcare, on our veterans, on the planet. So thank you so much for being with us today. Looking forward to doing this with you again soon, and hopefully someday soon we'll get to meet in person.
Yeah, definitely. Thanks, Jay. It was great meeting with you. Great talking with you today, and I look forward to talking again soon.
Awesome. Thanks so much, Brian.